Hi, my name is John. I'm going to be your student nurse today. How are you doing?
Hi, John. Doing good.
What's your name?
Ben White,
Ben White. Ben, when were you born?
October 20th, 1992.
Check your wristband, see if that matches up. And it does. Do you know where we are today?
Northeastern University.
Awesome. And do you know what today's date is?
It is
No cheating.
November 9th, 2018.
Okay. So patient is alert and oriented. Just from the general appearance, his skin looks good. No labored breathing using accessory muscles. Well groomed, good adequate hygiene. First, I'm going to check the scalp for any dry skin. Scalp is intact, hair is not brittle. Next, I'm going to assess your pupils. So do you mind just looking right at my eye? So before we begin, his pupils are at a 4. Okay. Upon white, the pupils contracted to a 3 and then accommodated back to a 4. They're both equal and round, reacted the same. Next, I'm going to test your cardinal gaze. I'm just going to ask you to follow my pen without moving your head. Perfect. Next, I'm going to test your corneal reflex. I'm going to ask you just to look at my nose and not look at the light. Perfect. Corneal reflex is intact. Next, I'm just going to have you open up your mouth and say, for me. Perfect. Mucous membranes are pink and intact. No lesions or sores noted. Tonsils are rated at about a 1. No cavities noted. Or seen, I should say. You're good.
Thanks.
Next, I'm going to assess your ears. You have any pain?
Nope.
Pain or tenderness when I do that?
Nope.
Alright, next I'm going to test your lymph nodes, or just assess your lymph nodes. You have your occipital lymph node, your post-auricular, your pre-auricular, your parotid lymph nodes, submandibular, submental, your anterior cervical, your posterior cervical, and the supraclavicle. All of the lymph nodes are soft and intact. No distension noted. Next, I'm going to have you shrug your shoulders for me. Thank you. Shoulder strength is adequate. Can you stick your arms out for me? Just feeling any tenderness or pain when I'm palpating your muscles here?
Nope.
Arm strength looks good. Can you squeeze my hands? Perfect. We're going to test the radial pulse. Both pulses are strong, equal. Next, can I see your fingers? Just testing capillary refill. Both of them were under 3 seconds. The capillary refill is good. Can you wiggle your hands for me? Perfect. Perfect. So next I'm going to listen to your lung sounds and your heart as well. But first I'm going to go with the lung sounds. So there are 6 fields here on the front. Oh, very nice. Very nice. So lung sounds were clear in all fields on the front here. Next, I'm going to listen to some of your heart sounds before I listen to your lung sounds on the back. The first one, the heart sound I'm going to listen to is your aortic valve. So that's in the second intercostal space, right sternal border. And S2 is supposed to be louder than S1, which it is. Next is your pulmonic valve, where S2 is also louder than S1, which it is. Next in the third intercostal space is the Erb's point, where both sounds are equal, which they are. Next is the fourth intercostal space, which is the tricuspid valve, with S1 sounds are more than S2. And lastly, mid-clavicular line, fifth intercostal space, better view, is the mitral valve, or the apex of the heart, where S1 is louder than S2. Next, I'm going to run through, I'm going to hit the same landmarks, but I'm just going to listen with my bell. Listen for any murmurs or bruities. I hear nothing, which is good. Nothing there. No bruities noted. Next, I'm just going to palpate your carotid artery. Very nice. Strong pulse to the brain. Perfect. Now I'm just going to listen to those as well with my bell here. Listen for any murmurs or brutes. Very nice. None noted. No murmurs or brutes. Can I just have you turn around? I'm going to listen to your lung sounds on your backside here.
Sure.
There are 8 lung sounds here on the back. First sounds I'm going to be listening to, we have your scapulas here, your spine. These are going to be your bronchial sounds, where inspiratory will be louder than expiratory. Very nice. I said that wrong. Expiratory is going to be louder than your inspiratory, which they are. I'm going to move down here to the bronchiovesicular, where both the lung sounds are equal on inspiratory and expiratory. And the next is the vestibular sounds, where the inspiratory is louder than the expiratory, which they are. Alrighty. Next, I'm going to check for symmetrical chest rise, so the 5th intercostal space. Take a deep breath for me. Very nice. Chest rise is symmetrical. Next, I'm going to test for CVA tenderness. Do you have any pain when I do that?
Nope.
Perfect. You can turn around for me. I'm just going to have you lay down.
Okay.
Pull this out for you here. Okay.
Do
That's
the
not-
camera.
That ain't it. Right there. Looks good to me. So next, I'm going to assess the patient's abdomen. Have you had any pain or discomfort in your abdomen? Any tenderness?
Not lately, no.
Okay. So upon inspection, I see no distension or pulsations, no visible bloating. When was your last bowel movement?
This morning.
This morning, okay. So first I'm going to listen to your belly here. Start in the lower right quadrant. And I would listen until I hear some gurgling. If I don't hear anything, I can listen up to 5 minutes. I heard active in all 4 quadrants. Any trouble eating?
No.
Any nausea, vomiting, diarrhea?
No.
Okay. Next, I'm going to listen to some of your arteries. First, I'm going to listen to your aorta, which is right here in the middle. I'm listening with my bell. And listening for any murmurs or bruities. I hear none, which is a good thing. Renal arteries are next. And we always compare things bilaterally. So we're going to go over here. Next is the iliac arteries. I hear nothing. I hear nothing. This is the femoral arteries. So no sounds noting using the bell, which is a good thing. Next, I'm just going to palpate your abdomen, okay? Let me know if you feel any tenderness, pain, anything when I do that?
Oh.
Okay. Next, I'm going to percuss All right. Next, I'm going to assess leg strength. Actually, gotta bring that over here. Around the world. That's good right there.
A little bit more. Just
Down?
barely on my foot. Yeah. There you go.
Ooh, look at that view.
Look at that.
Oh, yeah. All right, I'm going to assess for muscle strength coming down the leg. Is there any pain or tenderness upon me doing this?
Nope.
Have you had any noted edema, which is swelling in your legs?
I haven't noticed any, no.
No? Okay, I do not see any edema. Muscle strength of the legs looks good. Solid. I'm going to now assess some blood flow to the legs. If I can get his socks off. Yeah. So blood flow first is the dorsalis pedis.
Oh.
Oh. Sorry about that.
Hey, audience.
Oh, there it is. Dorsalis pedis. On the top of the foot. It's present. Always check bilaterally. Present bilaterally.
Always.
Next is the posterior tibialis, which is on the, you can't see it. Oh, perfect. Right in there. That is present. I'm going to do it bilaterally. It is present. Next, I'm going to check your capillary refill. Under 3 seconds. Under 3 seconds. I'm going to assess some muscle strength of the feet. Can you bring your toes to your nose? Perfect. And now push on the gas. Perfect. Muscle strength is adequate. No abnormalities noted. Next, I'm just going to have you sit on the edge. I'm going to test the patella reflex. The patella tendon. Good. Do you have any questions for me today, Ben?
No, great job.
Thank you very much.